Is everyone good to go?
Yeah.
Natasha, Fyles, Minister for Health. Good morning. So I've got an update for Territorians of the COVID situation here in the Northern Territory. We've got 43 patients in Northern Territory hospitals presently with COVID-19, and of this number, 27 are classified as being acute hospital admission for their COVID. We've got 7 individuals in the Alice Springs Hospital and 19 in Royal Darwin Hospital. One of the patients in the Alice Springs Hospital is in the intensive care unit, and we wish them, and we're thinking of them and their family at this time. We've got 2 cases in the Tennant Creek Hospital, but they're not classified as acute. They're there to receive care close to home. In total, we had 625 cases of COVID-19 in the Northern Territory in the last 24-hour reporting period, and 534 of these cases came from those rapid antigen tests, and then we had 1,474 PCR tests that were resulted in that reporting period. So 625 cases territory-wide in the 24-hour reporting period. This is a large jump on the figures that were provided yesterday, that we had yesterday with COVID, but we did, in a way, expect this. We do see around earlier in the week an increase in the numbers as weekend we have less testing, which reports into the Monday. In terms of the average case numbers, though, it's important to remind Territorians that if you put yesterday and today's figures together, you're still seeing around 450 cases today, and that's been about our 14-day average. So an increase today, but when you put it with the numbers we saw yesterday, it's not greatly concerning to us, but of course any case of COVID-19 can be serious. So the total number of active cases territory-wide is 4,142. I'll now provide some information for the regional breakdown, and then I do have with me Dr. Marco, who will also speak to that, and we're then happy to take any questions. Of the cases, the 4,142 active cases we have in the Territory, 2,971 have a Territory address in our systems, and I'll provide a breakdown of where those addresses are. This is their known address in the system, so the individual may have an address for Alice Springs, but they may presently be in Darwin, for example. 2,114 are in the Greater Darwin area, including the rural area. 543 are in Alice Springs or communities surrounding Alice Springs. 70 are in East Arnhem, 211 are in Katherine, and 33 are in the Barkly. I'll just now turn to some specific updates in the regions, and I'll start in Central Australia and specifically in Alice Springs firstly. And if you can bear with me, because I know this information is important to the members of those communities, so I am providing quite a breakdown, but it's important for people in each area to understand where the cases are. We've got 1 new case in Abbott's camp overnight, and there'll be continued testing in that camp in Alice Springs today. We've got 1 new case at the Old Timers camp in Alice Springs, but there's no new cases at the Old Timers aged care facility, so just to make sure people are aware, there's 2 different locations there. We do have 13 new cases at the renal hostel in Alice Springs, so that is a significant focus for our health teams presently. And we also have 8 new cases at the Alice Springs Correctional Centre, and that is taking the total there to 8 staff and 27 prisoners who have got COVID. So again, a significant focus for both our health teams and our correctional services teams. We've got 1 new case at the renal hostel. We've got 7 new cases in Amungana, just heading out nearby to Alice Springs, and that brings the total there to 28 cases. 3 new cases have been detected in Papunya. And heading over to Yuendamu and Yullamu, we've seen 9 new cases in Yuendamu, so that cluster has grown to 66. Of those cases, we did see 7 transported into Alice Springs yesterday. In terms of Yullamu, we weren't able to undertake any further testing in the 24-hour reporting period that we're speaking to. Both the airstrip and the road, as I understand, have got no access presently. The acting Territory Controller, the Acting Police Commissioner, Michael Murphy, is heading to Alice Springs today, and he'll have a focus with the authorities and teams on the ground, particularly around Yuendamu and Yullamu, considering the case numbers in Yuendamu and also the fact that we haven't been able to get into Yullamu, so that's a focus for us. We've seen 7 new cases in Arionga, which have been moved across to Alice Springs, as I'm advised. And then we've got 8 cases in Utopia, and they're off the rapid antigen tests in Utopia. And NT Health will work closely with the Community Controlled Health Organisation there in Utopia to make sure that they've got the resources they need. We did have a very low vaccination rate in Utopia. I do believe that it has seen some increase, but we again call on not only the residents of Utopia, but throughout the Territory, if you haven't been vaccinated, to please get vaccinated. As I mentioned, Tennant Creek has got 2 people in Tennant Creek Hospital, but they are there not as an acute admission. There's no new cases at the Barclay Work Camp. We had seen some cases there. In Katherine, the situation remains stable, and we thank everyone who's come forward for testing and continues to do so in Katherine. We do have a case at Bulla, which is nearby on that central Arnhem Road to Katherine. I'll just head across to East Arnhem to provide an update for some cases there, because there has been some significant movements, and Dr Marco will go into some more detail around those cases. In Gallawinku, we've got 8 new cases, which brings the total case count in Gallawinku to 27. All of those cases, as I've been advised, are close household contacts, and 4 of the cases have been transported to the Centre for National Resilience. The lockdown in Gallawinku continues until Monday. That was announced yesterday, and that will continue through till Monday. We are putting medical resources from Nhulunbuy into Gallawinku and working with the teams there so that we can make assessments and provide the best care for the cases and also their close contacts. There's been no new cases at Yirrkala in the 24-hour reporting period, but they do remain in that lockdown. They were in a 72-hour lockdown. We've had a focus on going in and testing those close contacts, and we'll now shift across. We're setting up a testing centre in Yirrkala today, so community members can easily access a test, and they can also get tested in Nhulunbuy. They can leave to go in and get tested. We have a case in Aliangula over on Groot Island. It is an individual, we don't believe it's related to travel. They don't have a known travel history, and some contact tracing work is underway there. So a reminder to Groot Island residents to please be conscious of your health. And in the Darwin Correctional Facility, we do have 4 new cases. We have a total of 8 cases in the Darwin prison. So I'd like to thank all the community organisations and the Aboriginal Medical Health Services that are working in partnership with the Northern Territory government officials. We really value the resources you're providing, your expertise and your information. We are dealing with a constantly changing landscape with COVID-19 in the Northern Territory, and I think it's a timely reminder to businesses and organisations, the start of a new year, that we should review our COVID management plans. Things have changed in the 20 months that we have had of the pandemic, and so has our response to COVID. So I just want to thank all the businesses and community organisations for their efforts, and just ask you to have a timely reminder of your COVID-19 management plan. The Department of Industry, Tourism and Trade, as well as Department of Health, can help you with those plans to make sure that you're basing your COVID management plan on the latest show directions and the latest health advice. 2 years ago, we knew very little about COVID. 2 years later, we certainly know a lot more about COVID, and we also have the vaccine. And that brings me to the point that we need Territorians to be vaccinated. We need our children vaccinated. We need people to get those booster shots. 45,000 booster doses have been administered in the Northern Territory, so 25% of the eligible population have received a booster dose, and we've had over 3,500 paediatric doses of the vaccine delivered in just a little over a week. So a great response by Territory parents and carers to make sure that our young children are protected with the vaccine. We've got 83% of our kids, teenagers, aged 12 to 15, who've received their first dose, and 71% are fully vaccinated. So as we head back to school in a couple of weeks' time, that vaccine is going to be so important. So for Territorians aged 12 and above in Darwin, Palmerston, across the Territory, you can get vaccine appointments today. For those children aged 5 to 11, there's appointments available next week, and I think next week is the last week of school holidays, so a great reminder to Territory parents and carers in getting prepared to go back to school. Give your kids the most important tool of the 2022 school year, and that's being vaccinated. So we need people to be vaccinated. Do it for your family, do it for your community, do it for those health professionals who, when you get sick, will call upon you. So I'll now hand to Dr. Marco to provide some further information, and then we're both happy to take any questions. Thank you.
Thank you, Minister. I'd like to talk a little bit about the hospitalization rate and expand on what Minister Fyles told us. We now have 43 patients in hospitals, of which one is in intensive care. These numbers are slightly higher than we had yesterday. However, a significant proportion of these patients are low acuity and they probably don't need high level of hospital care and could be cared for outside a hospital setting. Probably only 30 of these patients really need to be in hospital at this time. This rate is stable. Hospitalization rate remains about 0.6% of all cases, and the ICU rate remains low at 0.02% of all cases. This is within the expected rates and also within the capacity that we can manage. I think it's important to emphasize that we are making efforts to increase ability to care for Territorians outside of the hospital systems, and we continue to work to build capacity in primary care and in virtual care strategies to provide care outside the hospital and leave our hospital beds for those patients that really need to access that high level of care that cannot be provided in other settings. I also like to expand on the incursions that we are seeing of COVID-19 into what we call vulnerable settings or high-risk settings, but also in remote Aboriginal communities. In the last few days, we've seen a number of cases presenting in more and more remote communities, particularly in Central Australia and now in East Arnhem, that are of concern, and we are working very closely with the local Aboriginal medical services, with the other government agencies and with communities to ensure that we are responding to those outbreaks appropriately and that we're able to care for those Territorians safely closer to home when that's possible, or we can assist them to isolate or quarantine safely at home or in local facilities, or assist in transporting them to urban centres where they can receive the care they need or they can be supported to safely isolate or quarantine. The other important aspect is to talk about the partnership that we need to embark with community to do this together and to be able to care for Territorians closer to home in a safe manner. On the East Arnhem outbreak that is close to me particularly, I'd like to expand on the very strong partnership that we're doing with Lainapoi Health and with MeWatch, but also with all government agencies in the region to ensure that we can respond to these outbreaks closely. We can quickly get on top of what the situation is on these remote communities and manage with community and with our local partners these cases. One good story that we have seen on this is in the homeland of Gartalala, that is normally cared for the Lainapoi Health Association. Gartalala had an incursion like the one we mentioned. It's a very remote homeland, and we were very concerned about the implications. This individual did not know that he was positive when he visited the community, only found out a few days later he was asymptomatic and well. When we got the news that this was the case, a team from Lainapoi Health was deployed, 60 tests were conducted in one day, the whole community was tested, and this individual was retested and they're all negative and well. Of remark, the community of Gartalala has 100% vaccination rate, including boosters for anyone over 12 years old. And this probably was the difference between we dealing with a significant outbreak in a very remote site today and having the good news that we can give you today. So a reminder to Territorians about the importance of please getting vaccinated if you haven't. If you are eligible for your booster, please come forward for your booster. If your children are at an age that they are eligible for vaccination, please bring them forward for vaccination. We know the vaccine is effective, not only in reducing transmission, but more importantly in stopping people from getting very sick from COVID and requiring hospital care. In addition, I would like to remind Territorians about the importance of practicing social distancing, wearing masks, hand hygiene, and assisting others to do the same in order to slow down the spread and keep the territory a safe place for all of us. Thanks.
These clusters that are emerging in quite a few different facilities, especially in Alice Springs, are they concerning you and health authorities? Are there any extra measures being taken to ensure that people in those facilities are safe?
We already have a number of measures in those high-risk settings. There's national guidelines which we follow. So staff, for example, need to be vaccinated. But yes, we're certainly looking at these facilities and making sure anything additional can be done, and also making sure in terms of the continued operation for others that may be at those facilities that they also, we can reduce the risk of spread of COVID to them.
Can you confirm whether any nurses from inside Alice Springs quarantine facility have tested positive?
We have a number of health staff that have tested positive, and it's been largely related to travel and away from the workplace setting. I will have to seek some advice. I haven't been briefed on any specific cases of staff, but I'll certainly seek some further advice.
On the matter of utopia, you've mentioned a low vaccination rate, but what is the actual vaccination rate there? And then further to that, how many NT health staff have been deployed there to help with this outbreak?
Yeah, so Utopia is an Aboriginal medical organisation. I think it's sitting at about 40% first dose vaccination now, and so we're working with the health organisation there to see what resources they need. They've used the RAT test to get these tests, but certainly making sure that they've got the support they need. And that's where we come back to as well, a timely reminder for businesses and organisations and communities to update those COVID management plans. As I said, we know a lot more. We have the vaccine, so as we know, COVID has changed and will continue to change.
Do we have a number though on that amount of NT health staff?
I'm happy to seek advice off camera about exactly what resources have been sent in.
So we saw Yalara IGA banning unvaccinated customers. This is a decision that was made in consultation with the NT government. Are we going to be seeing this happen in other remote communities?
So my understanding is that was a community-based decision, and it was made in consultation with Mutijulu, the nearby community traditional owners of that area. And I've been to that community, met with those TOs late last year. They have a store already within Mutijulu that people can access. So it was a community-based decision that if you're unvaccinated, you're at higher risk of getting COVID and getting sicker. And so that community has made that decision.
Why is NT Health no longer providing a breakdown of how many cases have been reported from interstate travel, of how many in community and how many are mystery cases?
Yeah, so we have, as we've gone through the pandemic, in terms of our resources, we're focusing them where we need in terms of the information. So with the uploading of the RAT tests online, people can do those without the PCR test. As people know, the contact tracing has changed as well. So it's just as we've transitioned through the pandemic, we've focused our resources where they're most appropriate. We, of course, will let people know if we see, a large outbreak or certain international countries certainly provide health information, but we're not providing those daily breakdowns.
Right now, people are really informed if they've been to a specific exposure site, if it's a super spreader event. What's the threshold for that?
Yeah, Dr. Marco can add some more information to around the contact tracing and information for Territorians. Everybody, when they leave their home, should be expecting that they may come into contact with someone that's got COVID, or equally if some people come into your home. And that's why being vaccinated, wearing your face mask properly, hand hygiene is so important. So as we learn to live with COVID, and we see it is in every region of the Territory, it's everywhere. People, in terms of that information, it's a reminder to be vigilant to your health, and that you should be watching for yourself any signs and symptoms, and reach out to get tested if you feel unwell. I'm not sure, Dr. Marco, if you wanted to add something to that.
Thank you, Minister.
Can you step up to the mics a little bit?
Yes, I can. Thank you. So the idea of the text messages alerting Territorians that they have been to a place where COVID was present is a reminder. It's a reminder that COVID is around in our community, and that if you develop symptoms, you need to come forward and get tested. The ability of the Centre for Disease Control to track all cases remains, or is now focused on high-risk events or in clusters that we need to manage, particularly in high-risk settings. So all the other measures that we put in place is just a reminder that COVID is around. COVID is now prevalent in our communities, and all of us need to be vigilant to getting tested if we need, if we get any symptoms, or if we qualify for testing, or that we are practicing social distancing and other public health measures that reduce the spread.
Should people be getting tested?
Threshold of when people are notified if they've been to a specific place?
At the moment, if we have data or information that a case has been to a particular location, we are sending those automated notifications. The threshold is we knowing if people are checking in, and we know that you became positive, and we can track your check-in data, then we notify everyone that was in that vicinity about it. But the threshold is more about we knowing about those cases through the checking app.
So shouldn't people be getting a test anyway if they're having symptoms of COVID-19? What exactly do these text messages achieve?
Correct. So we have been very clear about our advice that if you have any symptoms in our current setting that you need to come forward for testing, this is just another reminder for people that might forget that very mild symptoms might be a sign of COVID-19, particularly in our setting with high vaccination. So it's just an extra reminder for all of us to be extra alert that the possibility of contracting COVID.
How long after someone has been to an exposure site can they receive these text messages? Is it going to be a fortnight afterwards, for example?
I would have to seek the advice around the specifics, but it is anticipated that it's within a few days. But remember that we need the person that is tested positive, and then we go back through and check where they've been, and then the alerts can go out from there. But it's also a reminder to Territorians that on our website we've got some information for people that do test positive, and I think all of us now know someone, a workplace colleague or a family member or a friend who has tested positive, and we do need support to support them through the journey. And there is information on what you can do if you test positive, how you can contact family and friends, and it can be an awkward conversation or an awkward message to send. You may feel a sense of responsibility around that, but people should be encouraged to share that information, to take that time to think where they've been, who they might have been in contact with, and then we can all keep that extra vigilance. I know that I have been advised, I've been in contact with people and I've been extra vigilant, you know, monitoring for any signs or symptoms. Fortunately, to date, I haven't, but I think that is a reminder for all Territorians and to support those in our community that have tested positive, to look out for them. We're seeing people return from interstate or gaining it in our community.
What's the Northern Territory Government doing to make sure communities that go into lockdown or even locked out, particularly remote communities, have ample supply of everything they need, particularly if you have staff at remote stores who become COVID positive?
Yeah, so the Northern Territory has a really good system of emergency management, and it's built off natural disasters, floods and cyclones, but you see that from the cabinet process of a Security and Emergency Management Cabinet through to the Territory Controller, and so that is one of the logistics tasks that the Emergency Operations Centre undertakes, is making sure that we have not only supplies but people that can provide those supplies to the community. So with an expanding number of remote communities seeing COVID, we're certainly working with the Aboriginal community organisations, Aboriginal Health Services. There's a number of people that come together under that grouping, and so EOC, the Emergency Operations Centre, is undertaking that role.
And so do you have people who could potentially go and work in remote stores then if there was an outbreak where, you know, a store manager and 3 retail staff catch COVID?
So in terms of the Northern Territory, we've always made sure that we ensure that our remote communities, particularly that are more vulnerable because of isolation, remoteness, that they have the resources and the supplies that they need. So there's a number of measures that could be put in place to ensure that.
What are the measures?
So as I just said, through our emergency practices, we're very versed in making sure that supplies are getting through and that they're getting through to community members. So it could be working with a community organisation, it could be working with the land councils to ensure that those supplies are available.
What does that actually mean? Like, what's the actual?
So what it means in reality is, if we've got a remote community and we see key staff taken offline, we may deploy staff in to fulfil those roles. We may see if there's other community members. You often see this in community, that council workers will step up and do other tasks. So I know that Territorians in those remote communities, and we're seeing the wet season and we see that impact of roads being cut off, so we're well versed at making sure that supplies get through to our vulnerable remote community members.
Can you comment on how the IDH and the Alice Springs Hospital are holding up at the moment, given the high number of cases we are seeing?
Yeah, so we've got a number of our Territory hospitals, Nhulunbuy and Alice Springs and Katherine, have all been dealing with COVID patients, whether they're transferring through to another facility or whether they're involved in responding out to communities. So our health workers and those that support them are doing a wonderful job, and we acknowledge their efforts. It certainly is hard going. I think that every health system in Australia is under pressure, so we're not denying that there's no pressure there, but our health staff are very resilient and they're adapting to ensure that Territorians receive the care they need.
What's the plan for remote communities, particularly as the school semester kicks off very soon, where you're going to have a lot of teachers who are coming from interstate hotspots with a very high likelihood of them having COVID, or a significant risk at least? What is the plan if, even with daily RAT testing, they go and bring COVID into a community?
Yeah, we've already had some of our remote schools return to the classroom. They actually have a flexible school year because that's what suits their community best. And so in terms of our teachers and other school staff and other health staff, they go in and out of these remote communities regularly. You see the process that we've put in place to support remote communities with additional testing. And these are people that love working in these communities. They love being a part of that community. And the last thing they want to do is bring bring the virus in, and so they're certainly utilising those public health measures of being vaccinated, of wearing a mask, of hand hygiene, and of course, testing regime. So there's a number of measures, and Department of Health and Department of Education will continue to work closely as we see the resumption of the school calendar year for all Territory kids. Thank you.
Number of 43 in hospital. So you've got 7 in Alice, 19 in RDH, which leaves you with 15.
I think the remainder are non-acute, so I think, yeah, that was just the acute and the
I do get 19 and 30 is 28 though. Right, I don't record the one without getting.
I've got the script upstairs, so I'll just look at it, just to verify.
Yeah.